Good evening, I'm Cynthia McFadden. We begin with America's children getting fatter by the day. The government estimates 9 million of them are overweight, many dangerously so, with the numbers growing. Doctors we spoke with call it an obesity epidemic, with many now suffering adult-like diseases like liver and heart disease because of their weight. Tonight, we bring you the story of one young woman's fight to lose weight, even if it means risking everything. It's the struggle of being underage and overweight. At 16, there were few insults Kiara Willis hasn't heard. It's hard for you to talk about it, isn't it? Can you tell me a little bit?
They call me Wobble.
Wobble?
Yeah, because they say I wobble when I walk.
Kiara is 5 feet 1 inches tall and weighs 368 pounds. Going to school is a daily ordeal. Kids tease her. Teachers, she says, look the other way. And finally, when she strikes back in anger and frustration, as she did quite literally, it was Kiara herself who was suspended for fighting.
I get mad and want to fight and just...
Punch fight or verbally fight or?
Punch fight.
Only rarely will she let strangers see the humor and sweetness she hides behind a wall of anger and hurt. As is so often the case, Kiara's whole family is overweight. Her mother, Trina, knows only too well how painful life is for Kiara.
And I can't stop everybody from staring. Our family's big. You never see nobody fat. You never seen a fat family before. I have my moments like that too. I get vicious with people too, because they just stare. They don't know us as a person. They just see the weight.
Print your name, date, and relationship to patient.
Kiara's repeated attempts to diet have failed, so she and her family have decided to take a controversial and bold step. Kiara is going to have an operation that will turn her stomach into a pouch the size of a walnut, gastric bypass surgery.
Right back this way, and then we're going to go to room 6.
It is not commonly done on teens because no one knows for sure the long-term results. Dr. William Klisch is the head of the obesity clinic at the Texas Children's Hospital in Houston.
Hi. How are you doing? I originally talked to the surgeons here about the possibility of developing bariatric surgery because I was seeing children literally dying from their comorbidities from obesity.
It is controversial.
Mm-hmm.
There are concerns. I mean, the kids are still growing. We don't know the effect of growing brains and in bodies when you have a stomach the size of a walnut.
Exactly, and that's why we're doing this whole thing as a research project. We're doing it very slowly, deliberately. All this data is going into a single database. We're going to look at just those things that you're talking about. Is the risk greater than the benefit? And that's always worries me.
Kiara is an extreme example of the direction American children are heading, says Dr. Klisch. How serious is the question of obesity in kids?
Well, in my estimation, I think it's the most serious public health problem we have in America today.
Sounds to me like there may be a price tag at the end of all of this for society.
There is a huge price tag at all levels. First of all, just the medical costs of this are going to become overwhelming. We think we have a problem with the insurance costs now. Just wait another 10 or 20 years when this generation of children start developing all these diseases.
It's that serious?
It's that serious.
Houston certainly has a problem. Considered one of the nation's fattest cities, Dr. Klisch says childhood obesity here is staggering.
We know in the city of Houston that 22% of our children are obese. That means that there are 220,000 children in the city of Houston that are obese.
But kids aren't only getting fatter, they're also getting sicker earlier. Obesity isn't just a cosmetic problem, it's a medical problem. For example, type 2 diabetes, which 15 years ago was virtually non-existent in kids, is now becoming much more common. Some young patients at Texas Children's are registering very high blood sugar levels.
That means there's 55,000 children in this one city who either have diabetes or are in the process of developing it. If a child developed diabetes before the age of 14, they lose somewhere between 17 and 27 years of life expectancy. And that life isn't going to be a good life.
Add to this other adult diseases now seen in fat kids: hypertension, sleep apnea, and even liver disease.
I am aware of 2 children in the city of Houston, 18 and 19-year-olds, who already have had liver transplants for fatty liver disease.
Because they are overweight.
Because they're overweight. 15% of obese children in Houston, at least by our studies, have evidence of developing steatohepatitis or fatty liver disease.
Which means at some point they may have to have a liver transplant?
Exactly.
Okay, go ahead.
So, without the surgery, what does the future hold for Kiara, whose father has type 2 diabetes and who has lost 2 cousins to heart failure caused by obesity?
What is your ideal weight when you're all said and done? What is your goal?
To be at least 230 pounds.
Pediatric surgeon Dr. Michael Helmrath has agreed to operate on Kiara because he believes if she doesn't lose weight, lots of it, and soon, her very life is at risk.
Bye-bye. Thank you.
I know that I don't want to be in the list of the people that has died and the people that just haven't done nothing about their weight or their health. They just sit and just constantly eat. And I don't want to, die at an early age. So that's why I'm doing this surgery.
Basically, as we were discussing, this is the upper portion of the stomach, very small, that's been divided.
One concern, once the procedure is done, it is impossible to completely reverse. And that's one reason only 11 other teens have had the surgery here at Texas Children's, only a couple of hundred nationwide.
There's a lot of ethical issues that need to be considered. The children that have life-threatening illnesses that will decrease their life expectancy are the ones to greatest benefit from this surgery.
Kiara has to persuade the doctors that she'll be able to change how she eats and exercises after the surgery, and that she will attend the required group therapy sessions before and after as well.
This surgery is a cure for obesity, true or false? That's right. What is it? It's a tool.
I don't even like home videos, girl. Cameras was nervous, for real.
Kiara's mother and her best friend came to support her as she became the 12th teen to have the surgery at Texas Children's.
It's nothing, they're just scared. That's all. And I'm going to be strong.
On a special gurney designed to support her weight, she is wheeled into the operating room for a surgery she hopes that will change her life.
Kiara Willis. She's here for a laparoscopic gastric bypass. She's supine. We have all our special equipment. There's no implants. You're Dr. Helmrath, I'm Dr. Brandt, and we're all blessed to be here.
Sure.
Kiara goes under the knife when we come back. And then we'll go forward in time 6 months to this very week to see the dramatic results and consequences you might not expect. We continue now with the dramatic weight loss journey of 16-year-old, 368-pound Kiara Willis. Is the surgery too much for someone so young to handle? This is a rare look at a surgery few teenagers have ever had. Inside an operating room at the Texas Children's Hospital, Kiara Willis is having her stomach turned into a tiny sack, only big enough to hold a few ounces of food.
So this is dividing the stomach into 2 pieces. The top one's about 10%, maybe even a little less.
The surgery will be done laparoscopically, using tiny cameras to guide the surgeon. But there is an immediate problem. The instruments aren't long enough to reach through Kiara's fat.
Her abdominal girth was so big that the ports that we used to put the camera in weren't long enough to get into her abdomen.
Her fat layer is longer than our trocar, which is the first time that we've seen that.
That was a problem for us that day. We dealt with it, but it was difficult.
Bypass is done.
3.5 hours later, Kiara comes out of surgery. 22 days after the operation, we met up with Kiara and her mother at the hospital.
I'm Cynthia. How are you?
Nice to meet you. Hi.
She weighed 368 pounds before the surgery.
So what are you hoping the number's going to be?
315.
315. Okay, that's what we're hoping for. Close.
38 pounds in 3 weeks. But even with her weight loss, it's clear Kiara is struggling.
Like yesterday when you called me, you weren't happy, were you?
No.
Okay.
Trish Salas manages all of the kids' cases here. She's on call 24/7. In fact, she's had the surgery herself.
It won't be like this forever, but for right now, it is pretty rough, isn't it?
It's very rough. It's very rough. And I can always tell by the tone of their voice.
the situation, and the situation usually surrounds, I need to eat. I want to eat. And the first question I ask is, are you hungry? No.
Kiara confesses she has regrets about having the surgery. She wants to eat even though the size of her stomach means she's not actually hungry. Food has been her comfort, her friend, and she hates to give it up.
I'm used to every time I get depressed just to go eat, and now I can't do that.
This is about a hunger up here.
That is, and it is a hunger up there that will always be there. And what you're seeing is a young adolescent that is right now overwhelmed with the amount of stuff that she has to develop.
Can she lose 100 pounds and meet her goal? And if she does, will she be able to keep it off?
Can you believe it's going to happen?
I don't believe it. I'm just used to being an overweight girl, so it's just something I got to get used to. They expect me to lose 50 pounds in a month, so.
All right, maybe you'll have done it.
Yes.
200 pounds or bust, right?
Okay.
Okay. All right.
I know what it is.
As promised, we went back to check on Kiara this week to see if she met her goal. She did.
I lost 129 pounds. I see a whole different person when I look into the mirror.
129 pounds. That's an astonishing amount of weight to lose in 6 months. But it was clear from the start it wouldn't be easy.
After I came out the surgery, I was happy. But farther down the road, I started getting depressed because food was my friend, and they took my best friend away. Having my family around because they can eat and I couldn't. And I just went to my room and just shut the door and started just watching TV while they downstairs eating. But I still got depressed because I knew what they were doing, and I could smell all the foods.
Kiara tells us, alone in her room, she wondered whether she'd done the right thing. She fell into a depression, didn't take her vitamins, had to be hospitalized, and even used a walker for a while.
I think she thought it was going to be quick and simple and easy, and then when she realized it was not that, it was really hard for her, and she's had a bumpy road. We work with her constantly, so I think she'll be all right.
Kiara says that while she knows there's still a long way to go, she's committed to getting better and losing another 50 pounds. And she's excited by all the new possibilities losing weight has opened up.
All our best wishes to Kiara. A final note, over 175,000 adults had bariatric surgery last year. Some doctors believe that is only 1% of those who could benefit from the surgery. There will surely be more on this subject.